You have available commands.
Participation in today's webinar on baby blues and maternal depression. Is there a silver lining? And our presenters are Dr. Jody, Todd Manley, and Dr. Robin Sturm. This webinar will be recorded. I'm requesting that you all mute your lines, please. And you can do that by entering *6 to mute. And you can also use *6 to unmute your lines. We will also place all the lines on mute during the presentation so that the recording is clear. Please use the chat feature to ask questions and direct those questions to Jody and Robin, and they will address the questions throughout the presentation when possible. After the webinar, you will receive a link to a short evaluation on the webinar. Please complete, as your feedback and comments are important to us. Dr. Manley and Sturm, you may begin.
All right, thank you.
All participants are now in listen-only mode.
Okay, so everyone, we are really excited to be here with you today to talk about a very important topic, maternal depression. It's a topic that we know certainly can impact many of the clients that we are working with. My name is Robin Sturm. I'm from the Mount Hope Family Center in Rochester, and I'm the project director for our Building Healthy Children program, which is a program that works with teen mothers and their babies. And I'm joined today by my colleague, who I will let introduce herself.
I'm Jody Manley. I'm the clinical director here at Mount Hope Family Center. We're in Rochester, New York, for those of you who are listening from around the state. So we're happy to be able to share some information with you today, and also some national resources. So I'll let Robin kick it off.
So together, Jody and I really have been working in this area of depression for many years, and while it is a difficult and tough topic to talk about at times, it really is a critical and important topic that we do put out there because of the number of families that can be impacted by it. So the title of our webinar, again, is Baby Blues and Maternal Depression, Is There a Silver Lining? And what we want to try to do is just talk a little bit about what is it that we do know about depression, what's out there already, and why is it so important to keep talking about it. It can be really hard for us as service providers, as home visitors going into the homes that we work with, to see our clients who are struggling with feelings of depression or going through a depressive episode. But one thing that we really want you to keep in mind, not only throughout this webinar, but also in your work that you're doing with your families, is that depression is treatable, and that's really good news. That's certainly what we want to keep in mind, and that's what keeps me going, I know, when we're trying to do this work that we're doing with families. So let's first start by trying to define what depression is. We do know that it's not just a bad mood. People can't just wake up one day and say, oh, I'm not going to be depressed today. It doesn't work that way, and it really is sort of a complex illness that consists of many different symptoms that show themselves in many different ways. Everyone kind of experiences depression in their own unique way, and those symptoms really are going to differ from one person to the next. If we look at the criteria for a major depressive disorder from the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, it includes having either a depressed mood or a loss of interest or pleasure over a 2-week period, plus a combination of at least 4 out of 7 different symptoms. And some of those symptoms can fall under lots of different categories. Some of those symptoms might be emotional in nature, so that sadness that people might be feeling or that anger that some clients might have. Perhaps they're feeling more agitated or irritated. Some of those symptoms can be physical in nature, so that client who is saying that they just have no energy, they're fatigued and tired all the time, or perhaps they're having some sleep disturbances. They're either sleeping too much or at the other end, not sleeping at all. They could also have some changes in appetite where some people, for them, it's shown where they have no appetite whatsoever, whereas other people might be eating a lot and overeating. And then finally, well, also some of those symptoms can be interpersonal in nature. So those are our clients who are really feeling that they are socially isolating themselves, or they're withdrawing from the world kind of around them. Maybe they're not enjoying being around people or doing activities that they used to enjoy doing. And then some symptoms are cognitive. So those are the symptoms where people might be, you know, whereas before they could concentrate, they're all of a sudden finding that it's really hard to focus on things or to make decisions for themselves. And so their symptoms are showing through in that way. And the overarching kind of hallmark symptoms of depression really are sort of this hopeless, helpless feeling that clients can sometimes get, where they feel like nothing good ever happens for them, or they're feeling like a failure in some way, or perhaps they feel like they're being punished for some reason, and this overarching kind of low self-esteem that clients can have. So when we talk about depression with our families, we talk about it being a medical illness, but one that can get triggered or exasperated by what's going on in one's interpersonal world. So the relationships that they have with the people in their life, or the events or situations that they're experiencing, and the impact that that can have then on their mood. Now, if we were to look at any of these symptoms in and of themselves, these are things that we all experience at one time or another, especially after a loss or a stressful experience that we might have. But when these symptoms begin to either cluster together or when they don't go away very quickly, then that's when we might want to see about getting some help for our clients. Now, there are many different viewpoints out there about depression, and unfortunately there is still somewhat of a stigma that is associated with it at times, which really can make it difficult for our clients to be able to either acknowledge it for themselves that they're feeling this way, let alone acknowledging it to other people. And that stigma can also make it difficult for the people that are in our clients' lives to either understand or be able to talk with our clients about what's going on for them. There have been, however, more recently some high-profile media cases that really have brought depression to the discussion table, and that's really a good thing. That's what we need. And while these stories can be difficult to hear, it really has provided some good information for us to work with when we are trying to address depression. So, for example, Brooke Shields, who wrote a book called Down Came the Rain, My Journey Through Postpartum Depression, she was able to talk a little bit about how her friends and family were really quick to dismiss what was going on for her. They kind of dismissed her sorrow that she was feeling, her sadness, or her disinterest after the birth of her daughter as a case of the baby blues. And they felt it would just disappear if she was just able to get some rest that was needed. But her sadness really escalated pretty rapidly into postpartum depression. And in her book, she did a really nice job of being able to articulate and express what the intensity of those feelings were for her. So just as a little quote here from her book, she said, "I wasn't simply emotional or weepy, like I had been told I might be. This was something quite different. In the past, if I got depressed or if I felt sad or down, I knew I could counteract it with exercise, a good night's sleep, or a nice dinner with a friend. If PMS made me introspective or melancholy, or if the pressures of life made me gloomy, I knew these feelings wouldn't last forever. But this was a sadness of shockingly different magnitude. It felt as if it would never go away," end quote. And I think, again, that really highlights the intensity of the postpartum depression that some women can feel. Another high-profile case that we have heard about is Andrea Yates, who had killed her 5 children by drowning them in a bathtub. Now, she had been suffering for some time with very severe postpartum depression and postpartum psychosis, and she was ultimately found not guilty by reason of insanity. But if we look at her history, Andrea Yates was someone who in high school was the class valedictorian. She was captain of the swim team and an officer in the National Honor Society. She went on to college and became a registered nurse. She married, and it wasn't until after the birth of her 4th son that she really began to struggle with depression, and severe depression at that. And then finally, Mary Richardson Kennedy, who was the mother of 4 children and the estranged wife of Robert F. Kennedy, Jr., she committed suicide in her home after a long-fought battle with drug and alcohol problems throughout her whole life. And Bobby Kennedy told the New York Times that his wife struggled with depression and was in a lot of agony for a lot of her life. So these high-profile cases really have brought to light the importance of talking about depression and the impact that it can have on individual lives. So what are the baby blues? What we want you to try to think about is somewhat of a continuum. And on that continuum, you have different varying degrees of intensity in terms of how severe someone's feelings might be. And at one end of that continuum, you might have sort of this passing sadness that we all feel from time to time. But as you move along that continuum, you'll have mild depression to moderate depression to postpartum and then major depressive disorder, then moving on to the far end of that continuum, postpartum depression with One in 5 women will get depressed in their lifetime, and that's a pretty staggering statistic for us. Unfortunately, those rates can go up even more under stressful situations. So for mothers with young children or for mothers who have young children and who are living in poverty or dealing with financial pressures, those rates can then go up to as high as 50%. Now, the research out there has consistently found that maternal depression also places their children at significant risk for poor development. And when we talk about poor development, we're talking about challenges that they might have in terms of their cognitive functioning, and challenges in terms of how well they're doing in school with their academic achievement, and as far as their social development, challenges they might experience in terms of relating to their peers or other relationships in their life. And we've also learned that research has demonstrated that children from economically disadvantaged families exhibit some of these impairments as well when compared with children from non-disadvantaged families. We've learned, too, that the parent-child attachment relationship can be impacted in that the rates of secure attachment are often found to be lower in toddlers of mothers with major depressive disorder. So what we really want to be able to do here is to strive in supporting not only our moms who are depressed to help them get back on track, help them be feeling better, but we also know that by helping our parents, we are also helping our children and the little kiddos who we work with. So, in looking at the diagnosis of postpartum depression, the official diagnosis really comes when symptoms, when there's an onset of symptoms that occurs within 4 weeks after delivery. However, a lot of clinicians and researchers will use a wider range in terms of that window, and it could be anywhere from 1 month to 1 year, with kind of 3 to 4 months being the most common time frame that people look at. And they also use a wide range of symptoms, again, noting that everyone experiences depression in their own unique way. They use a wide range of symptoms when looking at postpartum. And in terms of some more statistics, about 8 to 15% of mothers who do experience postpartum will experience it within their first year, with, again, the peak time being about 10 to 14 weeks post-delivery. But what's interesting here is that of those moms that are experiencing that postpartum, 50% really are continuations of depression that began for them during their pregnancy. So, what is it that we know about then the prognosis of depression? What does that look like? There certainly is a chronicity here to depression, and if someone does experience one episode, it really places them at about 50% chance or 50% risk of that depression reoccurring or coming back for them. If they have more than 2 episodes, then that goes all the way up to close to 100% of having another episode return. So while we know that depression can be chronic, what we want to hold on to is that with treatment, there is an excellent chance of recovery for them and an excellent chance of functioning in between those episodes for our clients. And the more complete the symptom remission, or the more we're able to help those symptoms be alleviated and go away, the more likely it is to be sustained. So this, again, is important for us, I think, to highlight and to emphasize not only for our clients, but for ourselves as home visitors going in and working with our families who are experiencing some of these feelings. we want to be able to maintain that sense of hope and that sense of motivation that things can get better for our clients and that they can feel better and get back on track, so that we in turn can pass that on to our clients and instill that hope for them. Okay, so let's take a look at some of the different risk factors that are out there for depression. Certainly there is a genetic factor, so a family history can definitely play a role in someone experiencing it themselves. However, there are also different environmental or situational events that could happen that could lead to someone experiencing depression on some level. So if people do experience a loss through death of a loved one, if they go through a divorce or become unemployed, if they are diagnosed with a chronic medical disorder, or if they experience some kind of trauma, whether or not they themselves a victim of violence, or if they are witnessing it or exposed to that trauma, those are certainly things that could impact someone's mood in a negative way. We already talked about the chronicity of depression, and so if they had a prior episode, they're more likely, and that is another risk factor for them becoming depressed again in the future. And living in poverty and all of the complexity that goes with that, all of the issues that are related in dealing with the day-to-day struggles or stress that could be associated with poverty, certainly could lead to some feelings of depression for some people. And then finally, what's been found is gender can be a risk factor. So it has been found to be twice as common in females as it has in males. So I just wanted to highlight again and emphasize for us this connection between trauma and depression. Certainly we can't get into all of that right here for this webinar, but it is important to make sure that we do look at this relationship. If someone is experiencing some kind of trauma in their childhood, again, whether it's something that they personally experienced in being abused either physically, sexually, or emotionally, or perhaps they're neglected as a child, or if they are witnessed and exposed to some domestic violence growing up, that could certainly lead to a presence of depression, not only for themselves during their childhood, but also could come up again in later years. And we know that children of traumatized mothers who are depressed are at particularly high risk here. So looking at the extent of the problem for children, what we see is about 50 to 80% of children whose parents have some major depressive disorder, they can experience some kind of significant problem. Now, it's going to depend on the duration and the severity of that depression in terms of the effect that it's going to have on the child, in terms of the outcomes for that child. But even a mild depression has been associated with some child problems. Now, typically, the more severe the parental depression, the more likely the child is to experience some challenges, but it's important to keep that in mind. Another thing to kind of keep in mind also is that the negative effects for children can persist even after the depressive episode has remitted for the adult. So even as mom has learned to cope with her feelings and those symptoms have alleviated for her, there still can be somewhat of a residual impact on the child. So we want to be able to acknowledge that. We want to be able to work with that. We know that the parent-child relationship can be impacted by any disruption that might have occurred in terms of their needs being met by the parent who maybe wasn't as emotionally or physically available when they were depressed. And so we want to be able to continue to process that and help them heal from that.
So, Robin, I think about that in terms of the intergenerational patterns. So the parental depression may have played a role in the history of why our current mom is depressed and what her experiences were in childhood, but also looking forward into the next generation and the impact of her current depression on her own children.
Absolutely. There's that link there that we want to pay attention to.
So if we can find a way to break that cycle and help get the family on a more positive path, that would be the ideal.
Definitely. So how does that happen? How does maternal depression affect the child, and in what ways can it affect them? What happens is that it affects certain aspects of the mother's ability to parent her child. So she may be, not as responsive to her child's needs as maybe she normally would be. In other words, she may not be able to tune into that child's cues or in terms of their needs and what they're trying to express that's going on for them at any given time. And that makes sense if we think about how depression looks and how it operates for some people. There's that sense of I'm feeling like I'm in a fog half the time, or I feel like I'm just kind of so isolated from everyone around me, or geez, I'm sleeping all day long because I'm just having a hard time dealing with what's going on for me. So really, how physically or emotionally available can they be for their child with some of these symptoms that might be going on for them? So there may be somewhat of a decreased sensitivity that they have towards their child because of that. They also might come across as maybe intrusive or hostile at times because of the negative mood that they have, or they just may be really inconsistent in their parenting approach or how they are parenting their child, or in terms of that availability that they have for them. And that inconsistency can lead to that child feeling really confused. Is mom going to be there to meet my needs today, or is she not? And really kind of having the unpredictability or the instability there in terms of their needs being met because they're not sure where mom is at on any given day. Now, when mom is depressed, she is also modeling some negative emotions for her child, and she just may be unable to assist with helping her child kind of regulate her own emotions. We know that young children certainly need support and guidance in regulating their own emotions. This is something that they, as a parent, we want to be able to provide for our child. But a parent who is depressed may be having a hard time or may be struggling to do that, at least on a consistent and regular basis.
So the child's exposed to both more sadness in the home and maybe that irritability that they feel. They're seeing more anger and more hostility as well.
Right. So children that are raised by a depressed caregiver can be at risk for challenges on a number of different developmental tasks. And maternal depression can lead to that child having an insecure attachment. It can lead to them experiencing some emotional dysregulation themselves or some cognitive deficits. It can also impact how they feel about themselves and that feeling of low self-esteem that might come with that, or impact their relationships with their friends, with their peers. It could also start to impact how well they do in school and how well they're functioning in that context. We also have seen some children who begin to then exhibit either internalizing or externalizing behavioral problems. So if you look at one end of the spectrum where there's those internalizing behavioral problems, we might see some of our kids who start to have some depressed feelings themselves, or maybe they're feeling anxious and have some anxiety about different things, or you see them beginning to isolate and withdraw themselves from what's happening around them. To the other end of that spectrum where we might see some kids who are acting out more or who are testing the limits a lot more or perhaps being overly aggressive.
Well, and that kind of makes sense to me, too, from the standpoint of if you're at school worrying about what's going on for your mom at home or not sure whether she's going to hurt herself or whether she's going to get the care that she needs, it would be easy to see how a child might have trouble concentrating. They might have trouble doing the normal kid stuff that they would do because they're focused on the challenges or what might be going on at home.
Absolutely. So while children can potentially have some of these outcomes, it is important to note, however, that there definitely are some developmental variations in that. And not all children will develop problems. So just because a parent is depressed, it doesn't automatically mean that their child is going to have some problems. It's going to depend on the severity of their depression. It's going to depend on how often that depression is reoccurring for them. And it's going to depend on, are there any buffering effects or are there any protective factors that are within the home that could help in terms of those outcomes. So if there is another healthy caregiver perhaps in the home who can attend to the child and meet their needs, or perhaps there is a caring adult outside of the home who is tuned in and can support that child. Or there may just be individual qualities within the child themselves that will allow them to be resilient, and despite a parent who maybe isn't as available to them as they would like or need, they're able to find ways to succeed and do well in school. So again, perhaps there's that child who really does well academically, and so in school, that's their safe haven. That's where they know that they can be successful, and they put their energy towards that. That can be a protective factor for them, so even though they may not be getting all of their needs met at home, there is something there that's helping them do better and do well.
Or even access to resources and getting treatment, or being able to have services available to the family can be protective.
So that's a nice segue into talking about what the different treatments for maternal depression are. And I think it's important for us to just have a general understanding of what these different treatments are that are available, not that we are providing them, but that we can be able to help our clients just know about them and let them know that they have the right to pick and choose whatever form of treatment feels most comfortable for them. We know that there are certainly lots of different medications that are out there that have been proven to be effective in alleviating symptoms of depression. We know that there are lots of different individual talk therapies out there, and a lot of times medication and individual talk therapies are used simultaneously, which really is the ideal situation when medication is needed. But there are some people who, for whatever reason, are uncomfortable taking medication. And so it is nice to know that that doesn't limit them, or that does not hold them back from getting treatment, because there are other forms of interventions out there that can be helpful for them. Here at Mount Hope, we use, for our talk therapy, we use two models, the interpersonal psychotherapy and the cognitive behavioral therapy, which are both evidence-based models. They're short-term, but they have been proven to be effective in helping people work through depression and alleviate some of those symptoms. So we know that those are two models that we utilize and have found very helpful for our clients throughout the years. There are also some forms of treatment in regards to group or counseling, couples therapy, and just general counseling in general that can help people learn to evaluate and just encourage them to stay on top of, you know, how much sleep are they getting, or how much exercise are they getting? Are they getting enough nutrition? Are they seeking out the supports that they have in their life? And so just kind of looking at a well-rounded approach to what could be impacting their mood.
And Robin, I think the point about medication is especially worth talking about from the standpoint of young women who are depressed, who may not want to take medications because they're pregnant, because they're nursing, and because a lot of people think that getting treatment for depression means taking drugs.
Right.
It's important to recognize that it doesn't have to mean that. And in fact, there was a study done looking at, even if you refer someone to a talk therapy, and then if that isn't sufficient to address the symptoms, have medication later, that is actually more effective than starting with the medication and then moving into talk therapy. So I think that while medication can be effective, it's not the only treatment available.
Definitely.
The other piece about depression is one of the symptoms is that hopelessness and helplessness. So a lot of times people don't seek treatment because they don't feel like it's going to work, because they have kind of given up and they're feeling hopeless.
Right.
But encouraging people to seek support, because it's one of the most treatable conditions, and there are a lot of things that do work.
Right. So what we want to do now is just kind of shift gears and share a story with you of one of our clients who went through our Building Healthy Children program. What I'd like to do is just give you a little bit of a background on her story, some information about her as she came into our program, And then we want to show you just a short video clip. It's just a few minutes long, but we like it because this is LaQuanda's story, and in the video, LaQuanda is able to share a little bit in her own words about her own experience with depression. And we are doing this because we think it's a nice way to kind of pull together exactly everything that we've been talking about up to this point in terms of how depression can affect an individual. So we had LaQuanda, who was 21 years old at the time that she enrolled in our program. She was a single mom of 2 boys who were aged 1 and 2. She had noted that her first depressive episode had happened during her first pregnancy, and she had struggled with that postpartum adjustment period and really reported that she continued to feel depressed sort of off and on over the next 3 years up to her time in coming into the program. So that depression for her kind of ebbed and flowed. In terms of intensity, it might have gone up and down for her depending on what was going on, but it never really fully went away. While she was in the program, she became engaged and got married, and she was able to talk about how becoming a mother and a wife were certainly major role transitions. It is for anyone. But for her, those transitions really, in her mind, led to this idea that she had to put some of her own goals, her own aspirations on hold, and that she wasn't able to pursue some of those for herself. So she described kind of, quote, sweeping her problems under the rug, and she actually spent a lot of her time trying to cope with this overwhelming sense that she was a failure in some way. Her time was spent on looking at all the obstacles that really were in her way of being successful, and she became easily defeated by this kind of constant negative self-talk, the would-haves, the could-haves, and the should-haves that kept running through her mind day after day. Now, scheduling and keeping appointments with LaQuanda was pretty difficult, but as a program in working with families our clients who are depressed, we understood that, and so we tried to be as patient as we could. We let her know that certainly there are some days that she may not want to let us into her house. She may not want to open that door to us that day, and that's okay. There may be some days that she wanted to open the door but didn't necessarily want to talk about really in depth what was going on for her, what she was feeling. So in terms of trying to help her work through that, letting her know that we get that we understand that that's how depression can operate and how it can work for some individuals. And over the course of her involvement in the home visiting program and within her depression treatment, LaQuanda really was able to talk about that transition into motherhood, to talk about becoming a wife. And she was able to explore the loss of the old roles that she had. She was able to kind of see the changes more positively in her new roles. And the way that she was able to do that was to know that it was okay for her to continue to take steps toward her own personal goals, especially around school. So in doing that, it helped her sort of find this better balance between the multiple roles that she had in being a mom, in being a wife, but also having time for herself. And so what did LaQuanda want for herself in terms of that? She reevaluated some of her friendships and relationships that she had and changes in her interests since becoming a parent, and that helped her kind of look at things in a different light. So we're going to go ahead now and show the video. It will just take a couple of minutes here. So this is LaQuanda's story in her own words.
Come on, baby. I had my first son when I was 18. My son was born sick. He had pneumonia. It was very hard and trying time. Scared, didn't know anything, and then I found out when he was 9 months that I was 5 months pregnant with his brother.
Oh, the boy!
All aboard the choo-choo train. I was not aware consciously that I was suffering from depression. It made the simplest things very hard, nearly impossible to do.
We have extensive research that shows that when moms have a baby that they're certainly at significantly increased risk of depression. And when you're looking at moms who have multiple stressors in their lives, including living in poverty, living in neighborhoods with high crime, about 1 in 4 women experience major depressive disorders.
After dealing with a sick child and having another child unexpectedly, it was hard, and that's when I got introduced to the program.
I worked with LaQuanda for
about a year. The IPT program is a home visiting model. So I would go out to her home on a weekly basis. The majority of the focus is on what's currently happening right now and what is contributing to their mood, whether it's events, situations, relationships that they might be in.
Oh, nice shot. Unfortunately, there's a significant stigma still associated with seeking help for a mental illness, and I think it's even worse in minority populations. There's somewhat of a sense of we should be able to pull ourselves up by our bootstraps, and we really don't need any extra help.
Something's going on, but you can't quite put your finger on it, and until I was presented with the information, it was something that I never really heard or was aware I was going through, but it helped me pinpoint what was the trigger that caused it and ways to treat it.
Jodi, you want to come to that table with us?
It's so important as a field that we continue to expand our efforts to looking at whether these interventions can be effective with lower income, more diverse populations, and I think this is really an important step in that direction.
Oh my goodness, this is so pretty. Let me see this.
While I was in the program, I got pregnant with my last son. I was at a better place to be able to receive him. Margaret helped me to keep my head above water, you know, to keep level-headed. LaQuanda maybe was a bit more unique in that she had the family support. She's married and parenting her 3 children along with her husband. So while she had that good support, she was also struggling with the depressive symptoms that were creeping up on that day-to-day basis for her. I didn't see my child as a burden so much, but I saw him as a priority. But she knows she worked with me to help me see that it was okay for me to set goals and say, I can still do something with my life. It feels good to see her succeed and attain some of those goals that she had set for herself a long time ago before she had children. I've always said I wanted to be in the medical field, and I am going to school now to be a dental hygienist.
What is these?
I'm very happy. It's been a long time coming.
Strawberry.
Okay. So, as you heard LaQuanda share, as her depression continued to lift, she found out that she was expecting her 3rd child, which was yet another major life transition for her. And while this did impact her mood, the cool thing, or the thing that is really great here, is that it didn't bring on a complete return of her depressive symptoms. And that was because of all the hard work that she was able to do in really trying to understand a little bit more about what her depression looked like. She kind of became that detective for herself in terms of what kinds of things let her know that she wasn't feeling at her best, that she was starting to get impacted by things that were happening in her life, and she acted on that. She kind of paid attention to it sooner rather than later, and that really helped her to avoid going into another depressive episode. So that's really exciting. That's really cool to see when clients can kind of go through a transition like that. LaQuanda went on to successfully complete the program. She obtained her GED and began attending community college. And as you heard, she has an interest in dentistry. So she certainly remained committed to building on all the success that she had. And she actually was featured on a radio show here in Rochester, which was very kind of cool for us. And she certainly is a success story. So what is it that we can do if we think one of our clients is experiencing depression? It certainly can be very overwhelming for us. We can think, geez, I'm not equipped enough to handle this kind of situation. I just don't think that there's really anything that I can do. But as home visitors, I think it's important to note that we are really in a unique position to be able to try to address a serious problem that oftentimes goes unnoticed. The Substance Abuse and Mental Health Services Administration, which is SAMHSA for short, they are a branch of the U.S. Department of Health and Human Services. They actually created a toolkit called Depression in Mothers More Than the Blues. And this is a toolkit that really does provide lots of information, things that we've been talking about up to this point, around the definition of depression, the signs and the symptoms that they have, and the prevalence. In the toolkit, they emphasize that depression affects people of all races, of all ethnicities, and of all socioeconomic levels. And it talks about, as we've been talking about, how depression certainly can affect a parent's ability to get close to their child, and they may have trouble responding to their needs. So if you haven't had a chance to take a look at this toolkit, we do highly recommend it. There's some really valuable information in there for us as home visitors. And what they do is they highlight or outline 3 different steps that we can take. First is simply to ask how the client is feeling. Second is to encourage her to do things to improve her mood. And third is to be able to try to screen and refer women who might have some more serious symptoms of depression. And what we want to do is just talk about each of these in a little bit more detail. So this may seem certainly overly simple, but really asking how a parent feels really helps. It can be very powerful for them to know that someone is interested in what's going on for them and that someone cares to ask how they're feeling. We know that when people are depressed, they don't always feel like talking to others, and we know that they're not necessarily going to initiate that conversation with us. But if we ask, maybe they'll tell us. And, you know, you may be the only one that they're letting in week after week into their home. We know that they might want to try and hide their feelings when they're depressed. But again, if you ask, then you may be the one that finds out what's going on for them. And at that point, maybe we can then try and encourage them to seek out support. As home visitors, I know we all work really hard at trying to build a positive relationship with our clients. We want to develop some good rapport with them and help them know that we're there to try to support them in whatever way that we can. And so if you are encouraging them to seek out support, they may listen if it's coming from someone that they actually trust.
We have another program here at Mount Hope Family Center. In addition to our Building Healthy Children Teen Moms program, we're doing a study looking at 13 to 15-year-old girls trying to prevent depression and trying to break the cycle in that way. And we've really been struck by doing a lot of outreach and just asking girls how they're feeling and asking about their symptoms of depression. And we've really been struck by how many girls not only tell us about their feelings of depression, but in some cases they've even been feeling suicidal or may have even made a suicide attempt and had never told anyone before. So sometimes just asking and just putting it out there and letting people feel comfortable to share those very painful feelings is an essential first step to getting them connected with appropriate level of support and the services that they need.
So asking questions like, have you been feeling down, or if so, for how long? Geez, can you tell me more about how you're feeling right now? Or you seem a little off this week. Maybe you seem a little down or irritable. Is everything okay? Maybe being even more direct about it and asking, have you ever been depressed? Or do you think your mood's been affecting your parenting? These kinds of questions really open the door for some dialogue. They open the door for some discussion around what's going on for them. And again, no one else in their circle of family and friends may be asking what's going on for them. And so we want to try and put that out there if we can. Now, as you are asking these questions, we want you to try and listen for different signs in terms of things that they might be feeling. Again, we're in this work because we all want to help others. And being a good listener is a skill that we know all of you already possess. That's something that you're already doing. When you have someone who's depressed, we might just want to hone in on that skill a little bit more. Because being a good listener, again, is letting her know that you care about what she's feeling, you care about what she's thinking, and that you want to try and support her in some way. So as you're asking how they're feeling and as they're responding, you're being a good listener, and you're able to try and pick up on some of these feelings that might come up. Feelings like despair, that kind of hopeless, helpless feeling that Jody mentioned earlier as being the hallmark of depression. Are you hearing things related to that despair that they might be feeling? Are you picking up on a sense of loneliness that they have? Are they socially isolating themselves or withdrawing themselves? Are they showing feelings of guilt, which is a really powerful emotion for anyone in general, but especially for someone who is depressed? A lot of our moms blame themselves for feeling down, or they become very critical of themselves, or they think that it's just them that's feeling this way. They worry that they're not doing what they need to do for their children or taking good care of them. That guilt kind of gets triggered for them. So what we want to try and do is validate the feelings that they're having. Let them know that this is not just something that they can, quote, kind of snap out of. And we help them by putting it in a context for them, the context of depression. You know, this is the depression talking. This is the depression operating. And in doing that, what you're doing is you're really helping your mom separate herself out from that depression. So it's not that she's lazy. It's not that she's unmotivated. It's not that she's a failure. That's the depression operating, and that's the depression working. And as they hear that, I think that can be very kind of eye-opening for them, and it can really help them in terms of working through some of those feelings.
Well, and people don't always use the term depression, and they may not always put all of these symptoms together in a way that, you know, we can see it as depression, and we can see that it's a treatable condition, et cetera, but they may not have really viewed it in that way. So even giving that framework can be helpful.
I think it can give sort of that aha moment for them at times, you know, like, oh, wow, this is what's going on for me. This is why I'm feeling the way that I'm feeling. And that's where it then instills some hope for them that something can change, something can get better for them. So the second step that they talked about was trying to remind her that she needs to take care of herself in order to help others, particularly her children. I think, you know, when people or when our moms are depressed, again, we talked about how they can withdraw or, you know, isolate themselves from people or activities that used to make them feel better. But what this does is kind of creates this negative spiral for them that only makes their mood worse, and you see this cycle kind of continue for them. But encouraging them to still stay involved may lift their mood for them. So we really want to encourage them to do some certain things for their children. We want to encourage them to be positive for their children as best they can, and to try to respond to their needs in helping them to eat, sleep, and play on a regular basis every day. We want to encourage them to provide healthy home-cooked meals for them and to keep their children safe. And the beauty behind this is if we are encouraging them to do this for their children, it's also happening for them then, because they are part of those routines that are being developed. They are part of, you know, if they're providing healthy meals for their children, chances are they're eating those healthy meals themselves as well. So it really helps in both ways. We know, again, when people are depressed, they can kind of have that negative lens on, which can really make it hard for them to see who the supports are that are in their life. So we can encourage them and tell them to welcome the support that they have from family members and from friends. You can be someone who can kind of remind them of who those people are, and also maybe you're someone who helps widen their circle of support for them. You can also provide some education about how depression does make it difficult to stay positive, and that, you know, when that's happening, we get critical of ourselves, because, again, that knowledge is what can be eye-opening for our clients. That knowledge is what can help them understand what's going on, and maybe that can help push them a little bit to move past those feelings and to kind of fight those feelings a little bit and do the things that she's wanting to do. Okay, so I'm going to switch it over to Jody now, who's going to continue talking a little bit about ways to help our moms improve their mood.
So some of these things are basic and maybe things you're already doing. There are things that we're talking about today, just to link back to what Robin said earlier, that are in that SAMHSA toolkit on maternal depression. And that toolkit, by the way, is something that you can download for free on the SAMHSA website, and we can make sure that Raquel connects you with the link for that if you don't have those materials already. So in some of the strategies to help your home visitee improve her mood, first off is creating that supportive environment, as Robin described before, of being a good listener, providing that safe and accepting place where she can talk about her feelings and where you can provide support for that discussion. A lot of times when moms are in this kind of depressed place, they worry that they're going crazy or that there's something the matter with them. So having a place where they can air those feelings and where you can support them around how this may be part of depression, how they may be able to get treatment so that they can feel better. Just having that support of a listener can really be very powerful. For us, it may seem like, well, that's just kind of natural. That's just what we do in our home visitation role. But it's really important to acknowledge how powerful that can be. Because the depression can lead people to withdraw from activities, to isolate themselves, that encouragement and support to maintain a normal routine, to get involved with activities, even if you don't feel like it, like once you get there, you may feel better, and encouraging her to stay active, stay involved, and even stay involved in the program. So you can acknowledge that sometimes she may not feel like having a home visitor out, but those are the very times where it might be good to touch base with people and to keep other positive people in her life. Because if you're just alone by yourself, ruminating with those negative thoughts, that can make that negative spiral that Robin talked about earlier get even worse. So it could be reaching out and reconnecting. Who were those people who were important in your life before? Who are those people who've been supportive of you in the past? Can you just connect with those people, give them a call, send out a text? Because it could be that those very people that supported her in the past may be available to support her now, but she may have pulled away. They may not feel like she needs them or wants them in her life right then, but helping to reestablish those connections. And maybe even identifying who are other people that she can talk to. Maybe it's the pastor in her church. Maybe it's even her parents or friends or her partner, that it could take some encouragement even to be able to acknowledge these kind of feelings that she's having instead of just putting a smiley face on it and trying to be stoic. So encouraging her to do whatever positive things on a daily basis that she can do. So those could be different activities, even things like taking a bubble bath, some things that you can do, listening to music that help make you feel good. And not only does that help her to do some pleasurable activities that might make her feel a little better, but identifying and underscoring the choices that she has may help her to feel more in control of her life. It could be activities that she does with her child. So doing something fun, playing with Play-Doh with your toddler, or some of those things, what were the things she enjoyed doing when she was young, and can she expose her child to that and just do it for the fun of it. Encouraging her to do things that are free or not very expensive. It doesn't have to be a trip to Disney World that might make her feel better. It could just be a walk in the park, or it could be going to a street festival, or some things that don't take very much time, but just kind of focusing on those little moments. And I was hearing recently at a national meeting a strategy called the 3 good things. And it's something that you can Google, and there are a lot of things actually on the web about the 3 good things. But the idea behind it is identifying 3 positive things that happen during the day. And there's something different about the way your body encodes information shortly before you go to sleep. So at the end of the day, if she can jot down 3 things that happened during that day right before she goes to bed, it may help with her sleep and really identifying those positive things, focusing on the positive, maybe even focusing on her role in making those positive things happen. And look at those 3 good things can help to focus, instead of focusing on everything that's going wrong in your life, to focus on the things that are going well or that are enjoyable during the day. And they did a study apparently with some healthcare workers, I think in an emergency room kind of setting, with these 3 good things. And they asked the staff to just journal 3 good things every day for a week. And what they found was it helped with people's moods, it helped with their attitude change, they felt better about themselves and about how things had gone in their day. And when at the end of the study they said, okay, you can stop that journaling now, a lot of people continued on with it because it had made a positive change in their life. So that's something that we can even do as providers to help with our stress and managing the stress in the work that we do, because this work can be stressful. Talking with depressed individuals all day can bring us down. So it's something we can do as providers. It's something that we can encourage our clients to do. And it's a little strategy, but focusing on the positives can make a big difference. So because people often pull away from things that make them feel good as a result of their depression, and because they can even have things that they used to enjoy, they're not enjoying as much anymore, reconnecting with some of those pleasant activities, encouraging people to continue to try and do something that they enjoy and to take care of themselves. Some of it is that stuff that your doctor would tell you. Get enough sleep, make sure you're paying attention to good nutrition, exercising. Exercise is actually a great strategy for helping to improve depression. It gets the blood flowing and can make you feel better in a lot of different ways, making sure you have enough water to drink, not just caffeinated or sugary drinks. So all those things that your doctor would tell you can also help not only with your physical health, but with your mental health as well. And a lot of times, parents especially have trouble carving out time for themselves. Maybe they feel like they need to do for their family and may not take enough time to take care of their own needs. But it's really difficult to have any emotional energy left to give to somebody else if you haven't refilled your own cup. And as they say on the airlines, put the oxygen mask on yourself before you administer it to somebody else, really encouraging parents to take some time for themselves, do something fun, go to a movie, go for a walk, do something with a friend, or it could be something to challenge your learning, like LaQuanda finished her GED. She started at a community college. It could be something that people derive meaning from. What can they do that's going to be meaningful for themselves, whether it's participating in their faith community, being active with a political or social or community cause, or it could be reconnecting with how good it makes them feel to be with their child and to be doing the parenting things, to be the kind of parent that they want to be. Relaxation is important. Relaxation can help with sleep and being able to go to sleep at night rather than ruminating. If they can focus on their breathing and doing deep breathing exercises or yoga, or doing progressive muscle relaxation where you tense each muscle group and then relax it and focus on the feeling of the relaxed muscles, or visual imagery that helps take them to a more positive place instead of focusing on the negatives. So those are all those strategies that we can do to encourage people to have more positive involvement in activities in their life that might help lift the depression. But there are also some official kind of things that we can do to screen for depression and to connect them and refer them for services. So hopefully your agency has some procedures on how to do some screenings and how to make referrals. If you don't have standardized tools in your toolkit, there are a couple that are very commonly used. One of the simplest one is the PHQ-2. It's just a 2-question kind of screening, asking your client in the past month, have you been bothered by having little interest or pleasure in doing things, especially things that you used to enjoy? And during the past month, have you been feeling down or depressed or feeling hopeless? Even asking those 2 questions. And then if somebody answers yes to even one of those questions, then that gives you a clue that you need to explore that in more detail. So beyond that 2-question simple screening, there are other screening tools that you might be able to use. One is called the PHQ-9, which is like the PHQ-2, but it goes in a little bit more depth because it has 9 questions instead of 2. Some other tools that you may be familiar with, the Edinburgh Postnatal Depression Scale is very often used for postpartum depression. The CESD, or the Center for Epidemiological Studies Depression tool, the Beck Depression Inventory, those are all questionnaires that can help give you those questions to ask. And there's a lot of easily accessible information online about how to score those and at what point to be concerned. And certainly you can encourage her to talk with her primary care provider so that her doctor can certainly prescribe antidepressant medication as well. I would want her to be talking with her doctor or her child's pediatrician about depressive feelings that she's experiencing, because they can also hook her up with appropriate treatment. And if you do feel like it would be important for the client that you're working with to get connected with services, then making that referral. And there are some steps and some considerations that are in the SAMHSA toolkit about how to do that referral with an eye towards success and making that connection. So hopefully you're familiar with some of the providers in your community, but really making sure that if you're going to refer her to get treatment someplace, that you know that that place accepts the kind of insurance that she has. And if English is not her primary language, do they have bilingual providers? Do they have services that can be provided in a language that she feels comfortable with? Is their schedule available and accessible to her if she's working, or needs evening or weekend hours? Are there places that can provide an extended schedule of appointments? And if you know those providers, it's a lot easier to say, oh yeah, this is a really good place. Or I know that there's a social worker at this agency who's been great, and being able to connect her with somebody that you feel familiar with if possible. But even letting them know what to expect with the referral. A lot of times people don't connect the first time. You can suggest and make a referral, but either because of their low energy or their feelings of helplessness or hopelessness, they may need a lot more encouragement to actually follow through. And they may be very worried that if they acknowledge these feelings to a professional at one of these mental health organizations or something, that they're going to be put in the hospital, or they're going to be made to take medications that they may not feel comfortable with. So letting them know that there are treatment options available, and it doesn't mean that they're crazy if they acknowledge feelings of depression. And if they're not happy with the provider and they call and they don't feel like they're getting a good reception, or they're not getting a very good response, or there's a long waiting list, or even if they do meet with somebody and they didn't click with them, really encouraging them to try again, to find someone else. If they didn't like that provider and didn't hit it off, that it doesn't mean the treatment won't work. It may just mean that they need to try again.
Jody, one other thing that I've often heard from moms who are feeling depressed but kind of hesitant to seek out that support even when a referral is made is this idea that, geez, if I express how I'm feeling, I could lose my children. My children might be taken away from me. And I think it's really important to validate and acknowledge what those feelings are for that client and then be able to try to help dispel that for them. Let them know that that is not the case, that because someone is acknowledging feeling depressed, they're actually looking out for their children and trying to get the support and the treatment that they need. And so having that conversation with them, being very upfront about that, I think can help encourage them to take that next step.
And talking with them about what their fears are, what their concerns are, putting that out on the table. Maybe even when you help them with the referral, you can let that source know that they have certain concerns, or being able to talk about what might be the depression talking that might not be what they're likely to experience when they actually go in for services. So supporting them through that process, I think, really is the underlying message. And all of those things are concerns that they can talk about with their primary care physician as well. So there are times where it is more imminent, where you really want to get them connected with services, and it's important that they get into treatment immediately. So for a mother who is suicidal, or is thinking about hurting herself in other ways, like cutting or other types of self-harm, or someone who is thinking that she might hurt other people. If someone is in that imminent situation, then they really do need to be taken in for services like at an emergency department for evaluation right away. Also, other safety issues might be if there is a domestic violence situation or if there's violence occurring in the home. And so there are certainly situations where you may need to get emergency assistance and get them connected with mental health providers. So that could be calling 911. And getting an ambulance and getting a client taken directly to the hospital. It could be connecting them with domestic violence providers and getting her into a shelter. If a mom is homeless, looking at what services are available for homelessness, and she may need a shelter for herself and her family. And sometimes those questions are difficult to ask, and sometimes providers feel like asking if someone has thought about suicide is going to put that into her head. In our experience, it's often a relief for somebody to be able to acknowledge it and to be able to talk about those thoughts. And rather than putting it into her head, it's more like, thank goodness that somebody really understands how bad the situation is and how badly I'm feeling. And getting her connected with people who can do a more comprehensive evaluation may be important. Now, there may be other people in the home who can help with getting those connections in place. If there is a spouse, you can certainly ask about whether that person is supportive, whether they can help to address the feelings of depression, help her access services. But if you get to that extreme end of the continuum that Robin was talking about before, it's important to pay attention and to act on those immediate situations and to make sure that if you feel like it's kind of out of your league and it's more severe than you feel prepared to deal with, that you get immediate help from someone who does have the qualifications and the support and the resources available to address that situation. So as a home visitor, in some cases in our program we are doing therapy, but other programs are not set up that way. So if you're not actually providing therapy for depression and actually treating the depression, it still can be very useful to be able to help the client even identify what the feelings are. Can they articulate, can they name the feelings? Can you help to label that? And to normalize and help people understand how common it is to feel depressed. And especially for women in that perinatal or postnatal period, providing that education around depression, helping her to feel like she's not the only person who's ever gone through something like that. But even being able to identify more, what are the changes that she's seen? To be that detective, to notice what makes her feel worse, what helps her to feel better. Are there certain triggers that maybe a conflict with her partner starts this negative spiral? Maybe it's talking with her own parents and feeling criticized about her parenting. What are those things that head her down a negative path? But also, what are those things that help? What are those things that make her feel better, even if it's in the short term, to identify those positive strategies and do some problem solving around things that can be sources of support, what are the resources that she has, even what are the positive qualities about herself. Are there any things that she feels proud of? Are there any people that she feels like are a positive influence in her life? Because it's easy to lose sight of the positives in the midst of the feelings of hopelessness. And one of the characteristics of a depressive way of thinking is to have that feeling that everything is bad. When one thing goes wrong, that everything's going to go wrong, it's never going to get better, and that's the depression talking. So helping her to identify the ways in which there are positives that can help her turn things around. Identifying the social supports, too. There may be some barriers that have kept her from developing new or more positive relationships, but there may also be some skills that can help her form new relationships, make new friends, or you may be able to help her figure out the ways of maintaining a friendship that may be a struggle, but you can help her kind of get through the bumps in the road. And having those relationships and being able to maintain more positive relationships can be very helpful in battling the feelings of depression and supporting more positive day-to-day routines. So as we kind of are getting to the end here, I wanted to make you aware of a new national campaign that I learned about recently. It's called the Campaign to Change Direction. And part of this campaign is thinking about stigma and really trying to reduce stigma for mental health challenges and looking at ways in which mental health challenges may be similar to physical health challenges, and why is it that we can't discuss feelings of depression in the same way that we could discuss problems I'm having with my back, or we know the signs for a heart attack or for a stroke, and there are a lot of public service announcements out there about those physical health challenges. Why can't we have similar campaigns for mental health challenges? So we put the website up here. It's changedirection.org, and one of the campaigns that they've started is Know the 5 Signs. So the 5 signs have to do with mental health challenges and changes that people can go through that can signal that someone needs to be connected with supports or resources. So you can see the little almost like emojis for these 5 signs, which include personality change. Is someone not acting like themselves? Are they not feeling like themselves? Are they having increased agitation, increased feelings of anger or anxiety or moody behavior or depression? Are they withdrawing or isolating from other people? Have they stopped caring for themselves? They're not bathing as often. They're not taking care of their hygiene, or they're involved in risky behaviors, or they're feeling more hopeless. So these are the 5 signs that can be a signal that somebody needs some mental health support. And they've gotten a lot of celebrities that have been part of this Change Direction campaign. So Michelle Obama, for example, has recorded a public service announcement. Richard Gere is on board. And when I went on their website recently, I saw that Prince Harry had done either a public service announcement, or they have pictures of people holding up their hands, showing their 5 fingers as a way, as a signal for, knowing the 5 signs. So you can look on their website and look at the ways in which people are getting involved on the national and international level with Prince Harry now. And there are ways that you can get involved in the organization. I'm thinking that we'll be likely to see some of these public service announcements and to be able to see more promotion of these 5 signs. But it's kind of a simple and easy way to communicate this information so that becomes part of our national conversations, rather than these changes being hush-hush, and we can talk about our backaches all the time, but not so much some of these other issues, and that should change. So overall, there have been a lot of changes. We've come a long way with identifying and certainly treating mental health disorders. And there's more national recognition and less stigma today. And what happens in our brain and some of these neurochemical changes shouldn't be any different or any less socially acceptable than other health problems like high blood pressure. There is treatment available. We should be able to get people connected with treatment. But each of you who are listening on the webinar can be instrumental in that change as well. Certainly the changes don't happen just with mothers. Fathers can have symptoms of depression too, and non-parents. But the more we can raise awareness and even be instruments of that change ourselves, the greater the changes will be and the more positive impact we'll have on children, and the more we'll be able to break some of the negative cycles. So I will invite you in the time that we have remaining to ask questions in the chat box. I did get a question about whether providers can ask about spouses or find out whether spouses are supportive, or if the spouse or partner is supportive, can that partner help with depression? Are there things that a husband or father can do to support the condition? Certainly we can, I think, ask about their relationships with their partners or other important people in their lives. And if those people are supportive, enlist their help and see if our client can reach out to those supportive individuals. Now, we know that at times those relationships may not be supportive. There may be violence, or there may be challenges or conflict in those relationships. So if there's domestic violence, we want to connect the family with some resources and some supports and some services that are specialized to domestic violence. If there's conflict in those relationships, we may be also able to connect them to some family counseling, but we may be able to talk with our clients as well about, are there ways that they can help to address those relationship challenges help to get that relationship on a more positive footing as well. Because we know that it's difficult for partners who are living with a depressed individual. It's difficult for people who are struggling with depression to maintain positive relationships sometimes too, because the depression can take a toll on the relationships. So I invite anyone to put in additional questions in the chat box if you have other things that you would like to ask. Certainly any of the material that we've covered today or any other questions that you have about the work that you're doing and when depression has come up as an issue in the work in the home visitation that you've been providing. So we have about 5 more minutes. We wanted to be able to have some question and answer. And I'm hearing that someone had raised a hand. So if you have a question, type it into the chat box and we'll be able to see it. We learned last time that opening the line and having people be able to ask questions verbally on the line was difficult. In the last webinar, there was a lot of extraneous noise. So we could try that if people are having trouble figuring out how to use the chat box and finding it on there. Okay, so one question that came up was that there were 3 children in the video. The example said there were 2 children. Yes, LaQuanda, when she started with us, had 2 children, but then she found out that she was pregnant with the 3rd.
During her involvement in the program, she became pregnant, and so that's where we were talking a little bit about how the information and the knowledge of being pregnant for her 3rd child, while it was difficult for her, it was not something that sent her back into another depressive episode. So she does have 3 children.
And I don't know if we've heard from her lately, whether 3 is, if the 3rd child was the last child she's had, yeah. Or I'm not aware of her having had any more.
No, we have not heard.
Okay, so there was a question that came in, how is a home visitor able to encourage a mother to seek mental health without making her feel guilty about the effects to her child? That's an excellent question. And I think some of the way that we framed it is really to let people know that mental health treatment is available. There are people that she can talk with, even starting with talking with her doctor and letting her doctor know what she's been experiencing. But it is a delicate balance. We don't want to make her feel worse about what's been going on for her, but at the same time trying to instill some hope that there can be treatments available that will help her feel better, and that feeling better and following through with that treatment can be a real gift that she can give to her child.
Yeah, I would say, you know, we're helping them understand that this isn't anything intentionally that they're doing or not doing for their child. And again, if you can put it in the context of the depression talking, you know, we kind of let them know that when you're depressed, you're not going to be able to be at your best. You're not going to be able to be 100% and do what you normally would do. And that's not for lack of trying or lack of wanting to. And so by seeking out support, by talking with you as the home visitor, by possibly thinking about going and getting treatment, again, as Jody said, that's the gift that they're giving to themselves, their family, and in particular their child.
So there was a comment then that the client's coming out of the depression, but the home visitor is still seeing some impact on the child. And sometimes we have another program called Child Parent Psychotherapy, or CPP, that can help with healing that relationship. and really restoring a positive parent-child relationship, but trying to encourage the parent and the child to communicate with each other, to do more fun things together so that their relationship can get back on a better footing as that depression is remitting. Because sometimes, you know, just because the depression goes away doesn't mean that the relationship heals on its own. And the child may not trust that their needs are going to be met just because mom is seeming like she's feeling better today. How do we know that she's going to still be better tomorrow? So rebuilding that trust for the child as well, and helping the child, if they're old enough, to be able to verbalize their feelings and their wants and needs.
Yeah, so sometimes the child may need just a little bit more time to kind of catch up to that and recognize that mom is back on track and I can turn to her to meet my needs.
Okay, so I'm looking at the clock and I'm seeing we're at about 12:30, so I'm going to open the phone line to let Raquel make some final comments.
All participants are now in interactive talk mode.
I just want to thank you all for joining us. Look out for the email on the short evaluation. Thank you again.